Newborn babies, and in particular premature babies, they're very fragile. They don't have a lot of extra fat, so they lose their temperature very quickly. And when babies get cold, their respiratory rate slows and they forget to breathe, and their blood sugar goes down very quickly. So they can go from looking very well to very sick like that. Our transport team is called for various reasons. Anywhere for something as simple as a hospital has a woman come in labor and they're going to deliver a baby and they don't have anybody there that has delivered a baby or any doctors that can care for even a term healthy newborn. We get called for premature deliveries, unknown gestation deliveries, and we go lights and sirens to whichever community hospital needs us. The transport itself is basically a plastic box that sits on top of a stretcher that goes into an ambulance. On it has a way to keep the baby warm. So there's a heat source, there's an oxygen source, there's a ventilator, there's a bunch of pumps to be able to provide medications. We can monitor their blood pressure, their temperature, their respiratory rate, so all their vitals. We have the ventilator to help keep their lungs functioning until we can get back to Bryan in our unit. Not only do we provide service for here in Lincoln, Nebraska, but we provide service across the state of Nebraska and into Kansas. And you never know when you're going to have a baby that's going to need our care. And with the right equipment, we can provide the safest care possible for these babies. What we do is not done everywhere. It's pretty specialized. At Bryan, you become family. That's the great thing about this, is you're helping families through a crisis. You know, nobody plans to have their baby born early, or nobody plans to deliver on the side of Highway 2, you know. It's the greatest part of this job, is seeing babies that you know for all other purposes should not be here. And we get to not only help save their lives and keep them safe, but we get to become a part of their birth story and the story that these families tell their children for years to come.
I was doctoring in Marysville, Kansas, and we're originally from Washington, Kansas. I hadn't had any complications, everything was good, and doctors weren't concerned for anything up until I went in for my last 2-week checkup. I told him I just saw a little spotting that morning, and you know, that throws up a red flag for him, and so they noticed I was actually dilating, so I was in active labor. At that point, he realized that I was probably going to deliver that day. So that's when he called in the NICU team up here from Lincoln. I was actually impressed with how much technology and what all they can do just even before they put him in the transporter to get on the ambulance. Once I saw everything and said my little goodbye through the little hole that they gave him, I was okay. I knew he would get there safe and sound. Nothing could hurt him then.
It kind of put me at ease, I guess, knowing that he wasn't just going to be sitting on an ambulance bed, you know, for the hour-and-a-half trip. So it was nice, little bit of peace of mind to know that he was in good hands for the trip, and we didn't have to rush. It wasn't drive as fast as you can to get to the NICU as quick as you could.
We had to stay in the NICU with him for 30 days. I think a roller coaster is a very good example of a stay in the NICU. You know, they tell you he's doing great and, you know, he just needs time to grow, and, you know, but all you want to do is just get him home. So you kind of want to rush that along, but you just want to cheer him on so hard, but he can only do so much, and I knew they wouldn't send him home if he wasn't ready.
It's a different wave of emotions. You know, you finally realize you get to take your child home that's been able to, been in the hospital for 30 days, and the excitement for me was getting to see my other 2 kids finally get to meet them for the first time. So
I think the other 2 kids were over the moon excited, but then they were also kind of like, can we touch him? You know, is he gonna stay here? Then they both got to hold him and love on him, and then they didn't want to put him down after that. So it makes you feel good as a mom. I think it's an absolute honor to be a part of the situation. You know, we don't get to tell our story very often. If you can benefit another family that is going through the same trying time, and know there is light at the end of the tunnel, and you can get through it.
The amount of peace of mind that came with knowing how good of hands he was in, how good their equipment was, it made the whole early steps of the process very easy.
He's doing great. You would never know. We had to stay a month here in the NICU. Yeah, we're growing like a weed. You're just loved, huh?
Every day is just a blessing.
Hello, I'm Dr. Craig Sitzman, a neonatologist in the Bryan NICU. The Hubbard family is just one of hundreds of families who have found themselves in the need of the Bryan transport team each year. We are proud to be there for our healthcare colleagues, medical centers across the region, and most importantly, our newborn patients in need of specialized care. Join me in supporting this generous match opportunity from the Git-R-Done Foundation as we come together to make a difference. Every gift at every level matters. Thank you.